Hello everyone, it's Topher Edwards, author of the BPD Journal series, and now that I have done a quick introduction and my origin story, I thought I would get into the main question of what is BPD, borderline personality disorder. Now, the American Psychiatric Association has decided that there are 9 criteria that define someone with BPD, and I'm going to go over those with you and explain a little bit about them and then go through my experiences with them, experiences I've seen with friends that have had it, and people also who have shared their stories with me, some of them being readers like you. So let's just get right into it. The first is a fear of abandonment. People with BPD have a fear of abandonment that is clinically significant. Saying that you have a fear of abandonment is pretty normal. Most people don't like that. What makes this different is that it is, like I said, clinically significant, meaning that it is more profound than usual. So they fear that because of the extent of their mental illness, that people around them will leave. They'll get fed up, they won't want to deal with them, and away they go. Unfortunately, I have experienced that, but the ones who have stuck around have shown themselves to be awesome support systems, awesome people, and some of my closest friends, and of course my family. The second is a history of chaotic and unstable relationships. And this doesn't just include romantic relationships. This includes friendships, work relationships, relationships with your doctors or counselors, and so on. There tends to be a lot of drama. There tends to be a lot of chaos. Due to the other criteria, it just makes it hard for someone suffering from BPD to maintain a stable relationship. And, well, if you've read anything I've written, that is a testament to that one. The third is an unstable self-image. A lot of people have one. Again, this goes back to the clinical significance, where people with BPD have a very unstable self-image, and it does not take much to set them off. At one point for me, it was so bad, I would constantly get my parents or friends saying that I looked pale and sickly, and or saying my eyes looked sunken in. And then the quintessential mom question, have you been eating? That type of thing. And it just feeds back into that self-image, the poor self-image that already exists. So really it's a vicious cycle, and it's a hard thing to get past. The fourth is impulsive behavior, and that's one I've really struggled with. It could be spending money, shopping, drinking binges, drug binges. Could be really anything impulsive that is detrimental to one's mental health or physical health. Anything that is just really not good for the person or people around them. They make quick decisions on the go. One beer can turn into 10, and next day they will be wondering, what the hell happened? What did I do? And next thing you know, that they're broke, or again, if you've read, you know. So, number 5 is history of self-harm and suicidal ideation, or unfortunately, successful suicide attempts. 10% of people with BPD will successfully commit suicide. and most of them fall into the 18 to 35-year-old range. Um, Sorry, I've experienced this, and it's hard. I've been hospitalized multiple times um, for overdose, for cutting, um, 11 to be exact, uh, from 2009 till 2014. So in those 5 years, I was hospitalized 11 times. And this is really one of the main points of concern, and the reason is obvious. They will do things like cutting, which was a big thing for me. Drug use is another big thing. And unfortunately, it's a cry for help that goes unheard. Looking back, I realized that if I really wanted to kill myself, I would have. I wanted help, but I wasn't ready to ask for it outright. I was too caught up in my own mind. I was too unwilling to admit that I had something so insidious that I needed help. So I just kept going through this cycle, and I kept falling through the cracks of the mental health system. I would go in with an overdose, and I would be released after my form was up 72 hours later. And in a few months, I'd be right back in. And there wasn't much follow-up. There wasn't much outpatient care. And that's the thing that really bothers me about this whole mental health system. But anyway, number 6, extreme emotional mood swings. So, this is where it is often confused with bipolar. And about 2 years ago, I got a new psychiatrist, and he did his whole assessment, and he informed me that I did not have borderline personality disorder. I had bipolar 2 disorder. And in a weird way, it rocked my entire world. So I asked why. And he said, what you have is not a personality disorder. It's a physical, neurochemical disorder. Like I said earlier, the swings are quick, whereas in bipolar, which I will address in a future video, the swings can last weeks. So I will spend weeks at depression and then go into a state of hypomania, which is just a bit less severe than mania, for about a week, maybe 2, and then swing back into a state of depression. So it's a lot more predictable. It's a lot more stable, I suppose, for lack of a better word. Whereas people with BPD, they can swing like that, an hour later they're like that, back and forth. They go from love to hate, from happy to sad. In the blink of an eye, there is no gray area. It's black or white. They think that it's their way or the highway. The swings are extreme sometimes, and sometimes they're subtle. So the thing is, though, that he still believes that I have borderline traits. So what this is comorbidity, meaning I have multiple disorders at the same time. So I have bipolar 2, which is my main diagnosis, with borderline traits, major depressive disorder, generalized anxiety disorder. I have OCD. That's not as extreme. I was diagnosed with Tourette's a while back. I have essential tremors. I have ADHD. So I have all these different acronyms, and it's just, they're piling on, and I'm wondering, like, how many more they can fit. my symptom list into, and it's just getting ridiculous. But again, that will be for a future video. The comorbidity where things can get foggy because there are so many symptoms that it doesn't always fit into a neat box. And that's what makes treating mental illness so difficult. So, again, the mood swings, they're quick, they're extreme, and it's hard for people with BPD to see in the gray area. They live in black and white. The seventh is chronic feelings of emptiness. They always feel incomplete. They feel like there's a piece missing, and it's usually, they say it's in their chest or in their gut. They never feel whole, they never feel happy, and that's debilitating on its own. It's a horrible, horrible feeling, and it's just always there. And it's one that can really, really take you out on its own, not to mention with the other symptoms as well. The eighth is a bit more rare than the other ones. It's extreme paranoia without dissociation. So the paranoia I don't know too much about. I only had drug-induced paranoia from cocaine and amphetamine use. The dissociation I also experienced. There are two main types. There's a dissociation from yourself, which is depersonalization. You don't really feel like at home in your body, and it's really hard to explain unless you've experienced it before. And then the one that's a bit easier to understand is where you feel detached from the world around you, and that's derealization. You feel alone, you feel isolated, and that goes with the other symptoms as well, where you suddenly get this fear of abandonment, and that relates back to the paranoia, and they all feed into each other. And the final one is episodes of anger, sometimes explosive episodes of anger, where we're essentially ticking time bombs, and at one point it'll just all build up and then explode into just this episode of fury. And I've experienced that too, and you don't have any control, you don't know what you're doing, but you just know that all you can see is red, and that you're so mad. You're mad at yourself, you're mad at BPD, you're mad at the world around you, and you're mad at whatever poor soul the target of your rage is. So those are the 9 criteria, and it really gives you a shallow picture. It's the tip of the iceberg, and the 90% that's below the surface is really, really more important than people realize, because that's what BPD truly is. That's the heart and soul of the mental illness. And it's important to realize that this doesn't define someone with BPD. Everyone's different. Everyone experiences these different. They could have 1 or 2 of these. They could have all of them. They could have, some of them more severe than others. So there's really this big spectrum, and there's so many variables, and you cannot just put a label of BPD on and have this one schema in your head where if this is someone with BPD, this is how they're going to be. And that's where the stigma comes from. So, there's times where I feel like it's a well-tailored suit, and it fits me perfectly. And when I got the diagnosis of bipolar 2, one of the first thoughts that popped into my head is, shit, what am I going to do with the title of my book? Am I gonna have to drop the P out? What I'm gonna do? But I figured I'd just keep. So, silver lining, what we need at the end of the video here. A personality disorder is one of the better diagnoses. It can be treated with cognitive behavioral therapy. It can be treated with most types of talk therapy. DBT as well is a good one. You can learn coping mechanisms to deal with a lot of these symptoms. The prognosis on it, so what's going to happen moving forward is really good. Usually by age 40, people with BPD have adjusted, they've learned to cope, and they lead healthy, relatively, and I hate using this word, normal lives. So if you are diagnosed with BPD, there is hope, even when things feel so dark. So you hang on, you ask for help. You just don't wait. If you think you have BPD or any illness, you reach out to someone, because no one should have to go through this alone. There's always someone out there willing to lend a hand. And CBT really helped me, and if it's something you want to look up, I highly suggest it. There are a lot of great articles on it. And really that was the biggest thing that I pushed away at first, but once I finally accepted it and started to work with it, a lot of things changed for me. So, I hope this video was helpful. I hope I didn't drone on too much. If I did, let me know in the comments below. I've always wanted to do that. Like, subscribe, share the video. Let me know if there's anything else you want me to cover, if you have any questions. Like my Facebook page, facebook.com/thebpdjournals. My books are on Amazon. Third one is coming out soon, and we'll see you in the next video. Thanks.